Ms. Xing, did you want to add on that question on the product itself and the demographics of, and also the competition, Samsung and Apple? Please go ahead.
Yeah. So BioPay and Nusa Health, we are working together with hospitals and laboratories all over Indonesia, starting with Yogyakarta, to download historical data of patients into the app, onto our cloud. The idea is that it's meant for everybody. It's not just a small segment of population, because that's how it's, with a large majority of people, that's how it can benefit more people. So, I mean, obviously people use it for different users. Some of it would like their data to be visualized on the health portal. Some of it use it to monitor the vital stats. So we leave it up to the individual. And we want to tailor and design the product such that it's user-centric. So I believe that healthcare, just like any other products and services from other industries, should give a consumer experience, the same level of consumer experience. And I think people, everyone, including yourself, would expect that. And when I say consumer experience, I think most of you would think like Apple, or even Samsung, or Amazon. So that is the kind of consumer experience that we want healthcare, that we want BioPay to deliver in terms of healthcare. So that means something as simple as on your phone, mobile, digital, however much you want to engage it, it should be very convenient, very connectively easy for you. And I mean, for users who like to use it to a greater extent, for example, to help map out whatever lifestyle activities they do, or you could be the other extreme where you're just using it once a year just to visualize your healthcare data when you see the doctor on the portal. Or you could be like, maybe one day you just wake up in the morning not feeling well with a rash. You can take a picture and you can send it to your doctor. I think that's the kind of experience that you want to enjoy with regards to healthcare. And I think BioPay or Nusa Health in Indonesia will deliver that kind of experience in terms of healthcare service for you. Yeah.
Thank you, Xing. And now for the policy side, yeah. Several comments on policy. With first, Professor Herini from the hospital side, and then Dr. Lutfan from the medical doctor side, and then Dr. Andrea. Please 1 minute each, and then Mr. Steve, could you wrap it up and see what you see the future of all of this is going to be?
Thank you, Pak. Just about the policy and also like Pak Agus mentioned about the integrated data. Perhaps until now about the integrated data in our hospital, I think it's not available also. But in the future, we hope. Until now, we discuss about it in the academic health system, and then we hope we have the integrated with other hospital in the initial in the Yogyakarta, and then we hope in some hospital in Yogyakarta we have the integrated, and then we can, if we have patient and then we refer to other hospital, we hope the hospital also have the data from this patient. If there is available and then the patient is easier to use the Nusa Health, and the hospital also know the result, for example, the laboratory or radiologist result from the other hospital where the hospital refer to other hospital. And also about the policy, I think if like mentioned before, if about the ethic or also confidential from the patient, I think it's as before patient sign in the paper like the general consideration, the patient know if the data is our hospital know about the data, but from the Nusa Health is not so detailed about that, but the patient know if the result of the lab, if they can open in the Nusa Health. Yeah. Thank you.
Yeah. Well, integrations, I think it's the word which is easy to be said, but it's not always easy to be done, to be realized. And well, I think what Pak Agus mentioned is something which is what we need to do actually. I mean, there has been initiative to try to standardize, to integrate the data, and to also introduce the standard, which is hopefully with the same standard, then the data can be integrated. And I think the Nusa Health is an example in the micro level that the data integrations is the activity that also important. Just for example, then the data related to the medical data from the hospital with the demographic data and also the behavior of the users is something which is actually would like also to be integrated. And of course, then if it is can be integrated, then in the macro level, it can also be used and analyzed for the bigger purpose. And I think, it's what the government is also concerned related to the data integrations. And I think there is also the National Health Information System roadmap that one of the aim is also to integrate the data from the different level from the different institutions.
Thank you. Dr. Andre?
So thank you, Pak George. So, I'll make a short comment in terms of policy. So the policy will change if the government see this not just an application. This is part of assisted living technology. It will change the policy, the current policy, and it will create another policy that really accommodative to this kind of technology. Because the people will get the benefits and they will endorse this application to the government, and the policy will change. Thank you, Pak.
Thank you. And Pak Steve, you could wrap this up and how you see the future of all this technology will lay down.
Okay, so I think for the past 1.5 hours, we've been having an interesting discussion on how technology can actually help us to get a better healthcare services in the future. But I think in order for an apps or a system to be able to succeed in this market, it needs to provide several aspects. Number one is the benefit. So in terms of benefit, what kind of benefit? Number one is it must enable a better access to healthcare services or healthcare provisions. Number two is also improving the care management itself in terms of options that the patient be able to get in accessing through these systems. Number three is also providing the cost value benefit also for the patients or the physicians or the government in the whole. And I think number two, looking at the prerequisite must have that these apps have is that I think the synergy needs to be done. I think the synergy between public-private partnership is also going to be very important, especially within this BPJS era where we see this still some area need to be improved in terms of infrastructure, in terms of resources from the public sector, where I think private sector can play a more important role, more critical role into that sector. So I think once the synergy between payer, patient and physicians are formed, I think the synergy between the house, the human and the health will not be too far away from the future.
Well, thank you very much. So with the last comments of Mr. Steve is the public-private and partnership. Yeah. And this is the future of healthcare in Indonesia. And obviously healthcare is to provide quality living, and Indonesia as an incoming middle income country is moving into that direction. And so with that, to the organizers, Mr. Shoaib Kagda of the Indonesian Economic Forum, we are right on time.
Thank you very much, Pak George. Thank you so much for your insights and for your participation and for keeping it on time. It's very important. Can I please invite Mr. Patrick Tang, founder, chairman, and chief dealer of Sixcap, to give away the tokens of appreciation to our panelists. Sixcap, of course, is our principal partner for the Indonesia Economic Forum. And I think under Mr. Tang's visionary leadership, doing quite incredible work in Indonesia. And I think digital healthcare is going to really not only disrupt, but totally change the way Indonesians view healthcare. Thank you, Patrick, for your support. And maybe we can give away some of the tokens of appreciation to the speakers.
I think that way, Chief. Yeah,
Thank you. Maybe we can get a group photo. Patrick, in the center, please, next to Mr. George. I will be by the side. Thank you very much. Please join me in thanking the panel and Sixcap for hosting this event. We have a short tea break now outside for you to quench your thirst and maybe just stretch your feet. And we'll be back right here sharp at 4 o'clock. Thank you very much.